Welcome back to the channel. If you care about protecting your heart as you age, this video could be one of the most important you ever watch. Right now, millions of older adults around the world are taking medications that were prescribed with good intentions. Medications that relieve pain, control blood sugar, help with sleep, or calm stomach issues. But what many people are not told is that some of these very common drugs carry real, documented risks to the heart, especially in adults over 60. These are not illegal substances. They are not experimental treatments. They are medications prescribed every single day in clinics, hospitals, and nursing facilities. Over the past decade, cardiologists and cardiac surgeons have begun noticing troubling patterns. Hearts that appear far weaker than expected for a patient's age, unexplained rhythm disturbances, rising inflammation markers, and damage that does not match lifestyle factors alone. When researchers traced medical histories, the same medications kept appearing. Large-scale studies from respected institutions, including the Cleveland Clinic, Johns Hopkins, Stanford University, the European Society of Cardiology, and major medical journals now confirm that certain medications, when used long-term or in older adults, can significantly increase cardiovascular risk. To be clear, this video is not telling you to stop your medication. This video is about awareness, education, and informed conversations with your doctor. Before we begin, please like this video, subscribe to the channel, and share it with someone you care about, especially parents, grandparents, or caregivers. This information saves lives. Now let's begin. Medication number 7. Proton pump inhibitors. PP is proton pump. Inhibitors, often called PPAs, include medications like omeprazole, esomeprazole, lansoprazole, and others commonly prescribed for acid reflux and ulcers. Used short-term, PPAs are effective and appropriate. The concern arises when they are used daily for years, which is extremely common among older adults. Large observational studies involving millions of patients have shown that long-term PPI use is associated with a modestly increased risk of heart attack and cardiovascular mortality, particularly in people with existing heart disease. Researchers believe one mechanism may involve reduced nitric oxide production, a compound essential for healthy blood vessel function. Low nitric oxide can lead to stiffer arteries, impaired blood flow, and higher clot risk. For many people, symptoms can often be managed with weight reduction, smaller meals,
avoiding late-night eating, elevating the head of the bed when medication is still needed.
H2 blockers like famotidine may be safer for some patients. But this decision should always be individualized with a physician. Medication. #6 Certain antibiotics, fluoroquinolones. Antibiotics save lives, but not all antibiotics affect the heart equally. The fluoroquinolone class, including ciprofloxacin, levofloxacin, and moxifloxacin, has been associated with serious cardiovascular risks, especially in adults over 65. Multiple large studies have linked these medications to increased risk of aortic aneurysm and dissection, dangerous heart rhythm disturbances due to QT prolongation. These risks are uncommon, but when they occur, they can be catastrophic. Because of this, the FDA and major medical organizations recommend that fluoroquinolones be reserved for situations where safer antibiotics are not appropriate. For common infections, alternatives like amoxicillin, nitrofuran, toin, or trimethoprimosol fomethoxyl are often effective and carry fewer heart risks. It is completely reasonable to ask your doctor, is there a safer antibiotic option for me? Medication number 5. NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs include ibuprofen, naproxen, diclofenac, and celecoxib, widely used for arthritis and chronic pain. For older adults using these medications, frequently or long-term, research shows a significant increase in cardiovascular risk, including heart attack, stroke, and worsening heart failure. These drugs affect blood clotting, raise blood pressure, promote fluid retention, and disrupt protective prostaglandins that support heart health. Even short-term use has been linked to increased risk in vulnerable populations. Safer strategies may include acetaminophen with liver monitoring, topical NSAIDs, physical therapy, weight management, targeted exercise programs. Pain management should always balance relief with long-term safety. Medication number 4. Older diabetes medications. Sulfonylureas. Diabetes already increases heart disease risk, which makes medication choice especially important. Older diabetes, drugs known as sulfonylureas, such as gliburide, glimepiride, and glyclazide, have been linked to higher rates of cardiovascular death compared to newer therapies. These medications can cause low blood, triggering stress hormones that strain the heart and increase arrhythmia risk. In contrast, newer diabetes medications like SGLT2 inhibitors, GLP-1 receptor agonists have been shown to reduce heart failure risk and cardiovascular mortality in large clinical trials. For older adults with diabetes, medication review is one of the most powerful heart protective steps available. Medication number 3. Sleep. NICU and sleep problems are common with aging, but certain prescription sleep drugs raise serious concerns. Z-drugs and benzodiazepines, such as zolpidem, esopicolone, lorazepam, and diazepam, have been associated with increased cardiovascular mortality, worsening sleep apnea, falls and injuries that trigger cardiac events. These medications suppress breathing and interfere with normal sleep architecture, both harmful to heart health. Most effective long-term treatment for insomnia is cognitive behavioral therapy for insomnia, CBTI, which outperforms medications in clinical trials. Low-dose melatonin and improved sleep hygiene are often safer options when medication is needed. Medication has 2. Antipsychotic medications are sometimes prescribed to older adults for behavioral symptoms related to dementia or psychiatric illness. Multiple studies show that both typical and atypical antipsychotics double the risk of sudden cardiac death in elderly patients. These drugs can prolong QT interval, disrupt blood pressure regulation, worsen metabolic risk factors because of this. Black box warnings exist for their use in dementia-related behaviors whenever possible. Non-drug approaches should be prioritized. And if medication is necessary, lowest dose, shortest duration is essential. Medication number 1. Opioid pain, methotrexate and anacin. According to large population studies, opioids pose the greatest cardiovascular risk among commonly prescribed medications for older adults. Drugs like oxycodone, hydrocodone, morphine, fentanyl, and tramadol have been associated with increased cardiovascular death, respiratory suppression leading to low oxygen levels, autonomic nervous system disruption, inflammatory changes that accelerate heart disease. The risk is highest during initiation and when combined with other sedating medications. Modern pain management emphasizes non-opioid strategies, including physical therapy, nerve blocks, behavioral pain coping skills, and gradual tapering when appropriate. To be absolutely clear, medications save lives. But as research evolves, so must our understanding. The goal is not fear. The goal is informed choice. If you are over 60, a simple medication review with your doctor could reduce your heart risk dramatically. So here's my question for you. After watching this, are you planning to discuss any of your medications with your healthcare provider? Drop your thoughts in the comments. Share this video with someone who needs it. And don't forget to like, subscribe, stay connected because your heart deserves protection at every stage of life. Thanks for watching.